Who is the first speaker?
The first speaker is Dr. Ashutosh Kumar GUPTA. He'll be talking a paper on posterior zone 2 ROP, spectrum of disease and comparative outcome of intravitreal ranibizumab and Leo.
Good morning, everyone. My topic is posterior zone 2 ROP, its morphological spectrum and treatment outcome. The term posterior zone ROP was introduced in ICROP3 in 2021. It's the region that begins between the margin between zone 1 and zone 2, and its 2 disc diameter. It indicates potentially more worrisome disease. The morphology of ROP in posterior zone 2 is have not been well reported. So the purpose of this study was to report the demography, morphological spectrum, and outcome after laser treatment or intravitreal ranibizumab. It was an ambidextrous interventional case series. The study period was between July 22 and December 23, and the eyes with posterior zone 2 ROP were included. The following information were recorded from the clinical record, which included demographic detail like birth weight, period of gestation, and neonatal complications like respiratory distress, duration of oxygen supplement. All the infants were examined with indirect ophthalmoscopy, and red cam fundus photogram was done in most of the patients. The treatment was either done with 532 green laser or intravitreal ranibizumab. The dose was 0.25 milligram in 0.025 ml. It was taken as a favorable outcome when there was a complete disease regression, or unfavorable when there was greater than 3 clock hour of 480 RD or stage 4B or 5. Around 64 eyes of 33 infants were included in the study. The mean birth weight was 1400 grams, ranging from 960 and 2250 grams. The mean gestational age was 30 weeks. All the patients were outborn, that is, they were not from our centers, they were referred from outside. And 6 babies were twins. The mean oxygen supply was roughly around 10 days, and there was 11 infants which give history of ventilation support, 13 infants sepsis, 7 infants blood transfusion, and around 48.49 patients gave history, there was history of respiratory distress. So of 64 eyes, 11 eyes were treated with the intravitreal ranibizumab, and 46 eyes, that is 71.87, were treated with the laser. The eyes which were treated with intravitreal ranibizumab, there was no adverse event noted. Of the total eyes, 11 eyes, there was regression of the acute phase of the ROP post intravitreal injections. Later on, 7 eyes, they were due to reactivation, laser was done. The morphological features which were present in zone 2 was divided into 3. That was stage ROP, which was present around in 56% cases, and rest half was equally between hybrid ROP and AROP. The most common morphological feature was ill-defined ridge, which was in 25% eyes, followed by large vascular loop, small vascular loop, well-defined ridges, and pre-retinal hemorrhage was present in 14 eyes. There are few the photographs. This is red cam photograph of the left eye, AROP with large vascular loops and pre-retinal hemorrhage. This is another photograph of AROP, zone 2 posterior with large vascular loops. This is red cam photograph of the right eye, which is showing large vascular loops. This is another example of hybrid ROP, which is showing large vascular loops and ill-defined ridge. Same another red cam photograph, which is showing ill-defined ridge in a hybrid ROP. This is another example of red cam photograph, which is showing well-defined ridges. This is another photograph, well-defined ridges. This is left eye red cam photograph of hybrid ROP in zone 2 posterior, which is showing mat-like epiretinal progression, pre-retinal hemorrhage, and flat-shaped NV. Similar photograph. As I have already discussed, most 56% eyes have stage ROP, and rest were AROP and hybrid ROP in 22% cases. This is for example 1, where a 32 preterm male with hybrid ROP in posterior zone 2, he was treated with laser. Post-laser, there was a favorable outcome. This is another photograph with stage 3 ROP, laser photocoagulation was done with favorable outcome. This is 29-week preterm with AROP, intravitreal ranibizumab was given, and there was resolution of acute phase. After that, after 10 weeks, there was reactivation for which laser was done. This is another photograph of AROP where laser was performed and there was complete favorable outcome was there. So in my study, there were complete regression in 100% of the cases. Cycloplegic refraction was done 1 year of the treatment, which shows a mean spherical equivalent refraction of 0.025 diopter with maximum between -2 and +2.5. Thank you.
So, how do you decide which case to do injection and which case to do laser?
Sir, we give the parents. We discuss the parents about both the options of treatment. For injection, we have told them they require more follow-up as compared to laser, which require less follow-up. After that, we have always we have told them about the pros and cons of both the procedures. About laser, which is a permanent procedure, for anti-VEGF, they require close follow-up.
How
So
long
based
follow-up
on
you had? Sorry, how long follow-up you had? I think you.
sir,
follow-up
1 year follow-up, sir.
1 year.
Yes, sir.
You had recurrence in almost 22 cases.
No, ma'am. After we have
After the
we have
injections.
injected in 11 eyes, there was reactivation in all the eyes.
In all the eyes. So
Yes,
you had to
ma'am.
do lasers in all of
Yes,
them?
ma'am. Laser was done, and the average recurrence was 10 weeks.
Okay, okay.
And you didn't find higher incidence of myopia in these children?
Yes, sir. Sir, the myopia was the most of them are -2.5 and +2, most of them. Otherwise, the maximum was -4.5 diopter. But it was in very few cases. Though in the literature it has been found most of the cases who are treated with laser, they have got high myopia as compared to those who have given intravitreal anti-VEGF. But in our cases, the average was roughly, it was not a high incidence of myopia. But the limitation was that it was just a 1 year follow-up.
Yeah.
We have done,
Follow-up is
yes,
very less.
yes, ma'am,
So
because
you
we
cannot
are,
still comment on the
Yes,
myopia
ma'am.
progression which is happening in these
yes,
cases.
ma'am.
Yes.
Ma'am. Thank you, sir.
Thank you. Nice presentation.